Hi, everyone, and good afternoon from sunny Oxford, or good morning, good evening, depending on where you're joining us from. Thank you all for joining us today for the sixth session of our Engaging with Evidence session, webinar session even. I'm Andrea Anastasio. I'm a Policy and Engagement Manager at the Government Outcomes Lab, and together with my colleague Tanya Hamid, we'll be hosting today's session. We've got an absolutely stellar lineup of guest speakers joining us today to discuss how outcomes-based partnerships have been responding and adapting to the COVID crisis, and what we can learn from this experience about how these types of partnerships can help us support the recovery efforts. For those of you who are new to the Government Outcomes Lab or who haven't joined a previous Engaging with Evidence session, we're a small research center based at Oxford University, and we do research around the evidence for the use of outcomes-based commissioning, outcomes-based contracting. So we look at innovative financing models such as social impact bonds, outcome funds, and loads more. And alongside our research, we do have a very comprehensive program of engagement and convening activities, because we're very keen to make sure that the insights we generate, and indeed the insights generated by other researchers and evaluators in the field, are used, are accessed, are used in decision-making and in practice by experts around the world. So that's why we've launched the Engaging with Evidence series back in January. As I said before, this is the sixth session and it's the last one before we break for the summer. But we'll be back in October with new sessions on new topics. Very simply, again, if you haven't joined an Engaging with Evidence session before, the idea with these sessions is to just offer an open platform for policymakers, practitioners, and researchers from around the world to get together and engage with the latest findings from the field. We do like to keep these sessions really interactive, so do please use the chat to ask questions, but also to share your own reflections, to connect with others from the field. We found with previous sessions that people really enjoy the networking element on the chat, so please do make use of that. And in terms of what we've got prepared for today, we're going to follow a similar structure to other sessions. We're going to have two brief presentations looking at two recent and very fascinating pieces of research, one from colleagues at the World Bank and one from our own research at the Government Outcomes Lab. And then for the second part of the discussion, my colleague Tanya will moderate a discussion with a really diverse range of experts, some working at the front line, really on the ground, implementing outcomes-based partnerships, and they'll share some of the insights on how they've dealt in their work with the impact of the COVID crisis. But then we also have my trade from the World Bank, Emily Gustafsson-Wright from the Brookings Institutions, for bringing in the perspective of a researcher who's worked in this field for many, many years now. But before we hear from the first speakers, from Jessica and Max at the World Bank, we thought it'd be really nice to know who we have online in the audience with us. So it'd be great if you could use the chat just to say hello, say who you are, maybe say where you're based, and any burning questions you might have, or any particular questions that you hope to see addressed on the session today. A final thing for me to mention is that it's really lovely to see everyone's faces throughout the session. Just adds to that feeling of a community. So do keep your cameras on if you can, but do keep yourselves muted unless you're invited to contribute or to ask a question. We will pause throughout the session to take questions from the audience. And if you don't want to ask a question live, you can always drop it in the chat. Both Tanya and I will be monitoring the chat. I can see Jessica on my screen, and I know has Max joined us? Yes, he has. Okay, thanks, Tanya. So without further ado, I'll hand over to Jessica and Max from the World Bank. And before you start, if you wouldn't mind just very briefly introducing yourselves, that'd be great.
Sure. So first of all, thanks very much to GoLab for inviting us to be part of this session, and to everyone here for joining. My name is Jessica Lopez-Taylor, and I work for the Global Partnership for Results-Based Approaches, or GPRBA is our acronym. And we're a trust fund within the World Bank that specializes exclusively on results-based financing. So as with many of you, I'm sure, when the COVID pandemic hit, we thought, how will this impact our existing programs and beneficiaries? And how best can we help? And this was really the impetus for the paper that we're about to discuss on outcome-based financing, or OBF, as I'll call it for short, for service delivery, with a focus on the recovery from COVID. So in the next 10 minutes, my co-author Max Bodie and I will discuss the first two sections of the paper, which highlights really the value add of OBF, as well as the challenges in the context of COVID. And unfortunately, we won't have time to discuss the final section, which delves more into kind of the application of OBF in different sectors. But for those of you interested, you can always check out the full paper, which is published on our website at gprba.org. So now I'll go ahead and hand it over to Max to present the first section of the paper.
Thank you, Jessica. And for those who don't know me, I'm also at the World Bank. I used to be with GPRBA. I'm now with OPCS, where I do a lot of research on the P4R instrument at the World Bank. And also an adjunct professor at Georgetown University teaching on results-based financing. So we started this paper with simple observation of sort of like the state of the world. And two things really were important for us in terms of results-based financing. The first one is that, as everybody knows, there's a huge financing gap for reaching the SDGs, up to $3 trillion annually. And this financing gap has only become larger because of the pandemic. So this means that we have to make programs more cost effective. And where we can, we need to try to crowd in additional capital from the private sector. Secondly, state capacity in many low-income countries is very weak. And in fact, over the last few decades, research shows that state capacity has gotten worse in 3/4 of low-income countries. So if we want to improve the effectiveness of government programs, and we want to close that financing gap, we need to improve the state capacity as well. We need to think about that very carefully when we're thinking about results-based financing, outcomes-based financing. Can move on to the next slide, please. Thank you. So I'm just going to gloss over this slide because we don't have enough time to go through it. But the basic idea is, what has made results-based financing, outcomes-based financing cost-effective and conducive for innovation before COVID still holds, right? And the challenges that we're trying to address only have become larger. So in principle, results-based financing is a useful tool when designed well and used in appropriate circumstances to get greater outcomes at lower cost. Can we move on, please, to the next slide? What I want to focus on a little bit more right now is on the system strengthening aspect. I think in the impact bond world, we tend to think a lot about how to engage private providers, but most funding still for outcomes in developing countries is still in government. And actually, most results-based financing to date has been in government. The vast majority of results-based financing is done by multinational development banks, such as the World Bank. And so, for instance, the P4R program has committed up to $40 billion since 2012 to results-based financing. And that program actually targets primarily system strengthening in governments. And there also have been quite a lot of success stories in this area. We highlight some in the paper. For instance, I was the lead as a consultant on a project in Sierra Leone where we worked with a public water utility. And in a 1-year program, we were able to turn around the utility by improving its revenue by 33% and decreasing non-revenue water. And I think you want to be very careful when you're doing system strengthening results-based financing in two respects. One is you want to combine upstream and downstream results-based financing metrics. So you want to focus on institutional KPIs as well as outcome level KPIs. So, say is the public water utility improving its financial management, but also are they improving its revenues and non-revenue water? Otherwise, you risk just incentivizing mimicking good performance, which governments have become very good at. Secondly, you want to focus at avoiding creating structural inequities in outcomes or deepening them, because there are if you're working with public service providers across a big degree of geographies, you're just paying for the highest performance, you run the risk of leaving the lower performing areas behind. So you need to provide supplemental TA or perhaps differential pricing, higher prices for the poorer areas, lower capacity areas. So we can move on, please. Thank you. So to wrap up, there are like two more value propositions which we looked at. One is in terms of targeting vulnerable populations, which have become more vulnerable even through COVID-19. And there, results-based financing has a wonderful tool, which is differential pricing or setting results quotas, which allows you not just to mandate that the equal amount of, say, women and men in a program are being served, but that you're actually getting equal results, and which also allows you to really incentivize service providers to seek populations which might have higher cost to achieve results. And I think there are a lot of good examples of this in the literature. For instance, the Nepal Employment Fund has used this very effectively. And you could also look at a paper by Instiglio from 2018 on active labor market programs, where there are lots of different examples of how differential pricing and results quotas can be used. So moving on to the final slide and the final value proposition, which is around engaging private sector capital. All right, so I think there are two ways in which this can be beneficial. One, you get additionality. So you're actually crowding in more money into international development. I want to put a caveat to that. I think a lot of projects claim it, but do not necessarily succeed in doing so. So you have to be very careful in identifying the mechanisms in which this is going to happen. And one thing that often works is, so for instance, what GPRBA has done a lot of outcomes-based aid, where, for instance, bank loans were used to finance the programs, and they're covering the outcomes-based aid is covering the viability gap. And that's an example of where really additionality is produced. I think a lot of impact bonds, in fact, do not produce additionality, right? The second example of why using private sector capital is important is because it can allow the public sector to finance innovation by private service providers. And I think impact bonds have been quite good in doing that. And we have examples for all of these and short case studies in the paper. Thank you.
So now that we've addressed really the value add of OBF, the paper takes really a realistic view at the challenges and limitations of OBF in this context. And in some cases, how those challenges can be mitigated. So scaling OBF through governments, I think it's safe to say that long project lead times and high transaction costs are really commonly cited challenges of OBF. In an emergency situations like we are in now, often rapid response and relief is required. So realistically, OBF is usually not the right instrument for first response. However, when you think about sustainability, about medium to long-term rebuild and resilience, OBF is a very valuable tool. The costs associated with OBF are, of course, investments in greater outcomes, and will continue to decline with standardization and scaling. So an important focus of the paper is on overcoming these long lead times, balancing speed with quality and appropriate metrics for a sustainable response to COVID. This photo here is from a school in Ghana, where the World Bank, in collaboration with the government of Ghana, FCDO, and other partners like EOF, are getting ready to launch an outcomes fund, where we're working with multiple service providers really to help drive outcome-focused innovation at scale in the education sector in Ghana. Next slide, please. I think this is a really important finding of the paper, focusing on the issue and not the instrument. We should never push an instrument on a problem because OBF is not always the solution. While OBF does have considerable advantages in driving cost effectiveness and providing service providers with flexibility, its shortcomings, as I said, like long lead times, potentially rigid contractual structures, can present challenges during the pandemic. In some cases, funders may opt for hybrid models or blended financing, in which they tie only a portion of funding to outcomes, blending output and outcome metrics, as well as maybe more traditional input-based financing arrangements as appropriate. But I think it's also important to highlight here that while tying less funding to outcomes decreases the performance and financial risk for service providers or investors in the case of impact bonds, it may also reduce the incentive alignment and risk transfer to service providers. So that's why I've included this graphic here, which helps to show kind of the trade-off between tying funding to outcomes further up and down the results chain. Next slide. Outcome-based program design should be made as simple as possible without compromising effectiveness. I think overly complicated programs can reduce effectiveness and increase transaction costs and lead times. And especially in a crisis, OBF arrangements should be kept simple by limiting the number of outcome metrics and avoiding overly complicated pre-financing arrangements. I think sometimes a high-level, well-designed metric can really capture a program's desired impact, while also limiting the costs of designing, negotiating, and evaluating the program. Next slide. This one seems obvious, but actually is something that can really create quite a headache down the road if not thought through in advance. Actively managing risk by planning in advance for worst-case scenarios can mitigate the uncertainty created by unforeseen events and provide OBF projects with the flexibility to adapt when needed to continue supporting those vulnerable populations in times of crises. So in addition to things like specifying who bears the force majeure risk, establishing dispute resolution mechanisms, think also at the project design stage about alternative approaches, maybe establishing contingencies from the start to allow projects to adapt to changing circumstances during implementation. So here I put some questions that can kind of help guide these decisions. So I won't go through these because of time. But in the Ghana education example that I mentioned earlier, the team built in flexibility into the project design, which would allow for a more relaxed payment metrics in the case of a significant event, such as school closures due to COVID or other events where distance learning would be required. And then once that significant event is overcome, the project would then transition back to more ambitious outcome payment metrics. And then also through the competitive selection process, service providers are expected to include proposals for distance learning strategies using various technologies as part of their bid. Next slide. And finally, on verification, social impact is really at the core of OBF operations. And so these types of projects tend to have pretty robust M&E frameworks. This becomes a challenge in the event of an external shock like COVID, when results attribution becomes more difficult, on-site data collection may be impossible. In these types of situations, again, flexibility is key, and alternative verification approaches and digital innovation should be explored. Digital innovations for verification can be something as simple as phone surveys. And this is something that we've used in many of our projects over the last year. Whereas complex is using satellite imagery or drones, but there are really a lot of resources out there that go into more detail about this. So that wraps up our very short overview of the paper's key findings. I would say in conclusion, the paper finds that the core features underpinning an outcome-based contract, including innovation, efficiency, transparency, accountability, and flexibility, do make OBF a relevant and important instrument for improving the impact of service delivery for the recovery from COVID. So maybe not for emergency short-term relief and service provision, but for medium to long-term rebuild and resilience.
That's excellent. Huge thanks, Jessica and Max, for such an insightful presentation. So we've got about 5 minutes for questions before we move on to the next part of the discussion. Do put your hand up if you have a question that you'd like to ask. Maybe just to give everyone a little bit of time to think about your question. Jessica, I was wondering if I could come to you with a sort of specific question around the point around the routes to scale. So you've mentioned the Ghana Education Outcome Fund. So I was just wondering, if you could give us a bit more detail about how that fund operates and kind of how promising or how successful it's been so far in terms of addressing some of the issues that you've mentioned in your presentation around the complexity, the long lead times, and so on. And then the second part of my question is around what other routes to scale have you seen in your work? If it's not an outcome fund, what other routes to scale might we have?
Sure. So the Ghana program came to us from, as I said, FCDO and the Education Outcomes Fund. And essentially, the idea behind the program is to support out-of-school children in Ghana and to help reintegrate them into the mainstream school system. And this actually takes an impact bond model. It's one of, I believe, 3 impact bonds at this point at the World Bank, where we'll be working with private investors to provide the upfront financing to the service providers. And then the World Bank and the government of Ghana will reimburse the investors after certain outputs or outcomes have been achieved. So the ultimate outcome that we're trying to achieve really is an increase in learning outcomes of primary school children. So the program, the idea, the design started pre-COVID. And I have to admit that, the lead time has been extensive, partially because this is such a new instrument at the World Bank. There's a huge learning curve, on part of the procurement specialists, the legal specialists. And then on the government side as well, there's also a big learning curve. This is a completely new instrument for them and a new way of doing things. But COVID actually presented an interesting opportunity, like I said, to kind of think through, well, wait a minute, like if we're only tying payments to learning outcomes, if we encounter issues such as school closures, really these investors are taking a huge risk. So we need to start thinking about, building in some kind of contingency plan before the program is launched in the contracts that will say, if there is an event such as COVID that leads to school closures, how can we think about some intermediate outcomes to help reduce the risk of the service providers, of the investors? And so that's been a really interesting lesson for us. And also, we're able to really take advantage of some of the local knowledge on the ground through the competitive selection by saying, what ideas do you have? What technologies, can you think of that would help us to reach these kids during a time when they're not able to go to school? Because a lot of them may not even have access to electricity or to internet. And so, when you think about remote learning in these very rural areas, you have to get pretty creative. So at this stage, we haven't launched the program yet. So I can't tell you, exactly what the concrete results are. We're planning to launch in January for the start of the 2022 school year. And at this point, we're going through the procurement process to contract the investors as well as the service providers. But we're all looking forward to really seeing, the outcomes of this project. I think it's extremely innovative for the World Bank. And I think it'll be an important example going forward. And a lot of lessons have been learned about designing these kinds of programs in education as well as in other sectors.
That's brilliant. Thank you so much, Jessica. And I know in the third part of the discussion with the panels, we're going to look at more examples from the work of the World Bank. But thanks for that. I will now bring into the discussion my colleague Claire Fitzgerald, who will be presenting some of the findings from our own research on 31 social impact bonds that have been developed in the UK within the context of the Life Chances Fund. Claire, can I come to you? And again, if you could firstly just briefly introduce yourself, that'd be great.
Sure. Hi, everyone. My name is Claire Fitzgerald. I'm a research fellow at the Government Outcomes Lab. And as Andrea has said, I'll be talking a bit about what we see happening on the impact bonds that are funded through the Life Chances Fund. And I'll talk a bit more about that evaluation and how we approached this. But before I get to this sort of specific information from our evaluation work, I want to spend some time really talking about definitions of resilience and how we use those definitions in sort of the evaluation that we've been running. So we're starting on a more conceptual sort of angle, and then we'll move to the more applied. So what is resilience? When we look to literature in the academic sort of socio-ecological fields, we see this idea of two dimensions, the what of resilience and the when of resilience. And so the what is really, are we talking about an organization, a community, a project? Here we're talking about impact bonds. And the when is that sort of, is it immediately after? Is it during a recovery phase? Or is it actually a longer term? And both of these get further broken down, right? So the what is the sort of function and structure. So I'm an impact bond, and the functional resilience that I may be demonstrating is a continuation of service. But my structural resilience might indeed be my internal command structure, the sort of organizational identities around the table. And so being clear about sort of functional resilience and structural resilience as two different dimensions of this kind of concept of resilience writ large. Importantly, though, resilience has a temporal aspect, but we often don't necessarily unpick this very sort of strategically. And this, again, is that sort of, we think about precursor resilience, recovery resilience, and adaptive resilience. And we might think of these as overlaying the sort of more well-known emergency management cycle. But precursor resilience being that ability to cope with a sudden shock, and you can cope with that on the functional and structural side. A recovery resilience being about how well an organization or a partnership or an impact bond returns to some semblance of normalcy. And adaptive resilience being that sort of longer term ability to learn from your experience of reacting to a crisis to improve your capacity to withstand future crises. So when we think about this what and this when, an academic named Dewitt thinks about this nice ladder of resilience, which I have expertly rendered on this slide. And so we think about this as climbing up, starting with our left hand and then right hand, working our way up the ladder, such that organizations or partnerships or impact bonds get more resilient the further up the ladder that they go, all the way from just maintaining service delivery during a crisis, all the way to sort of being able to apply the lessons from that crisis to improve our future capacity to be resilient. And so this is the ladder that we use to understand resilience as it's demonstrated on impact bonds funded through the Life Chances Fund. If I can go to the next slide. Now, importantly, it's not that helpful just be, that is resilient, that is not resilient. We also want to understand what creates or what drives resilience. And there's a host of different sort of literature one can draw from to understand these drivers or causal mechanisms for resilience in partnerships and organizations and communities. We sort of use a systematic review by an academic named Barasa and colleagues and describe sort of three kind of key buckets of characteristics or ways of working that resilient organizations and partnerships demonstrate. One is on the governance side, and that is organizations and partnerships that have clear and flexible planning and decision-making processes that are as decentralized as possible seem to be more resilient. And that is sort of built out by scenario planning, as was articulated earlier, but also by sort of having the ability to know and rely on people to make good decisions as close to the sort of interface of crisis and service delivery as possible, as in the case of impact bonds. We also think about resources, both financial and material, as well as informational, and those not being so overstretched as to make adaptation impossible, right? So the importance of redundancy and slack in organizations and partnerships on the resource side. And then lastly, we think about the sort of drivers of resilience as human capital, of social capital, of trust, of embedded relationships, and an organizational culture that perhaps sees challenges as learning opportunities rather than as sort of negotiations around blame. So we're trying to think about these drivers and understand the degree with which we can sort of work up the ladder together. And in our case, we're thinking about them related to, as I said, impact bonds funded through the Life Chances Fund. So things to know about this fund: it's an outcomes fund. It is sponsored by the Department for Digital Culture, Media and Sport. And what it does is, for about 30 projects in England, it pays a portion of the outcomes payments associated with those projects. And so these are projects which span policy areas from children's social work and social care all the way to population health interventions and whatnot. So it's a real mixed bag of different sizes, different services, and different kinds of organizations collaborating in partnership on these impact bonds. And so we had this existing evaluation that predates COVID, but when the pandemic sort of happens, March of last year, we work in consultation with DCMS to really think about how we might really think through how the evaluation can answer some questions and capture learning as that's happening related to the pandemic. So we have these sort of functional and structural questions emerge, right? We want to understand functional resilience displayed by LCF-SIB and what drives it, as well as structural resilience by LCF-SIBs and what drives it. And the way that we uncover this is that we use a lot of the secondary data that we already sit on as evaluators. We look at management information, we look at the project reports that are carefully sort of collected by the TNLCF, the lottery fund, who's the grants administrator here, and the steering group around the Life Chances Fund. So we're using as much administrative information as we can get our hands on to really understand how these projects are making changes and adapting to a very volatile context at the time. And the way that we operationalize or sort of think through functional and structural resilience is that the functional resilience is best demonstrated by a continuation of service delivery in impact bond projects through the Life Chances Fund. And the structural resilience becomes a question on how able are projects to stay to their outcomes-based payment as it was initially specified. This requires a bit of explanation in the sense that Life Chances Fund projects at the outset of COVID were given the option to stay on their outcomes-based funding, to switch to an activity-based or grants-based payment, which was sort of like a guaranteed amount based on their medium case performance scenario, or indeed pause their project altogether. And so these projects had the option to pick one of those three. And we're looking at what they picked and why they picked it. So what did we find out? Next slide. This is a busy slide, but the headlines are essentially that it's a bit of a mixed bag in the sense that we see evidence that suggests that resilience was possible and why impact bond sort of structures were helpful for that, or the relationships around impact bonds were helpful for that. But indeed, some of the limitations of the tool and how that perhaps challenged some of the resilience that we saw. For time's sake, I'll go ahead and move to the sort of highlights, but happy to pick this out in detail later on. Yeah, next slide would be great. So we're back to this ladder, right? Which is sort of functional on the left, structural on the right, and how high up are we getting? So in the Life Chances Fund, we actually see quite a lot of functional resilience at sort of precursor and recovery stages, right? So service is maintained on all of the projects that were launched pre-COVID, and indeed a further 9 projects launched despite the pandemic, with services that are virtual altogether, or sometimes hybrid, or indeed are sort of bouncing back and forth. And then also that virtual or hybrid service delivery is now a more embedded and sort of understood way of working amongst project partners. Those changes to services, that functional resilience to maintain service delivery, was really driven by a flexibility of resources. So the ability to start spending differently and pivoting services as needed to contextual changes, but also by the human factors. So the embedded trust of project stakeholders on the ground, being able to work together and problem solve creatively, really sort of that partnership, formalizing and coming together a bit more meaningfully. So that's the functional side. On the structural side, again, we're looking at how close to their outcomes payments have they stayed. And actually a full third of projects stay or launch, right, on outcomes contracts. So they continue on as anticipated at the early stage. And then actually in the recovery resilience stage, we actually see all but one having returned to outcomes contracts as of February 2021. So we do see a certain amount of both precursor and recovery resilience, and evidence that the LCF impact bonds are indeed up at sort of rung 4 of this ladder of resilience. Can we go to the next slide? And so what do we make of this? What does this help us understand? As I said, the impact bonds seem to get to the fourth rung. There's precursor and recovery resilience being observed. But what we don't know is whether or not these impact bonds are doing it better than other kinds of partnerships, right? So we observe the resilience, but we can't really comment on whether or not it's more advanced or more rudimentary than other ways of contracting for public services. But it's worth highlighting that the impact bonds do seem to have particular strengths around service continuity and adaptation, and that importantly, those are driven by human factors and flexible resources. Indeed, this idea of flexibility of resources and sort of subsidiarity, decision-making at the lowest level possible, is really important in enabling these kinds of resilient activities to go on. And it does seem that the outcomes orientation coupled with shoring up a lot of the cash flow, either by investors or indeed by central government in projects where sort of grant-based payments were taken up, that was a really integral part in being able to pivot locally. But then finally, it is too soon to really know about that sort of adaptive piece, although that sort of learning feedback loop is one of the sort of touted benefits to doing work in an outcomes-oriented way. But I think we really don't know how well impact bonds are going to fare in the longer term, particularly the ones that were sort of designed pre-COVID. And the reason for that is inherent to the bond itself, right? Today's activities generate tomorrow's people outcomes. And so the LCF projects are likely to enter into renegotiation periods as the impacts of the sort of functional and structural adaptations, virtual service delivery, maybe changes to providers or changes to the governance arrangements, those impacts have yet to be seen. And so there's a question of whether or not we've just delayed some of the substantive changes on the structural side to a later date, once we know more about how the outcomes themselves are performed. And I think that's probably increasingly true for projects that are targeting outcomes in increasingly demanding contexts. So are you an impact bond that is trying to place people into employment? That's been really, really difficult. Are you an impact bond that requires in-service monitoring? So it's a diabetes prevention and you need to take people's blood sugar. That's become a very difficult way to evidence outcomes. Those kinds of hiccups, while they've had sort of maybe suspensions or temporary solutions embedded in the past couple of months, that will have sort of ramifications on how the impact bond functions overall. So, it's a watching brief for us, and we will definitely be learning more as time goes on. And I should say as well, this is not just my work, it's the work of the whole team. So it's definitely something as a group that we are interested in unpacking and learning more about as the sort of recovery and longer term effects of the pandemic are felt on these kinds of projects.
Great, thank you so much, Claire, for such a rich set of findings that you've shared with us. Again, we've got a couple of minutes before we'll move on to the panel discussion. So again, I'll give everyone a chance to ask their questions, either in the chat directly. Otherwise, feel free to just put your hand up. And if I see any hands up, I'll come to you. Again, just to give maybe everyone a chance to think if they want to ask a question. Now, Claire, I'm just curious, so based on these findings and this research, kind of any top recommendations or advice for those sorts of just getting started or about to launch new social impact bonds, any sorts of like practical tips perhaps around the flexibility and the governance arrangements that you've talked about?
Sure. I mean, I think obviously when you're operating in a pretty volatile context, as we have been over the past 12 months, real clarity over those governance processes and who is enabled to make what kinds of decisions become really important, so that you're not constantly sort of raising decisions to the highest level, but folks are enfranchised locally to make sort of reasonable decisions around pivoting or course correction for sure. And in that sense, really having folks who are data informed, understanding of the local context, and really know the partners around the table becomes immensely important just to be able to manage to that kind of context.
Brilliant, thanks for that. I'm not seeing any other hands up. And I do know we have a really rich discussion planned for the third part of the session. So I'll hand over to Tanya now to introduce the panelists. And thanks again, Claire. Thank you so much for a great presentation.
Great, thanks so much, Andrea. Hi, everyone, and thanks very much for joining us for the session. My name is Tanya Hamid, and I'm a Research and Policy Associate at the Government Outcomes Lab. It's great to be here with you today, and fantastic to see Claire presenting some of our recent research from the UK Life Chances Fund. I'm really excited for the next part of our session, where we are going to be going into the panel discussion. And today we'll be focusing on the role of outcomes-based partnerships, particularly in the recovery and rebuilding phase for COVID-19. So we'll be looking at some practical considerations for using outcomes-based partnerships, as well as some sector-specific best practice. We're very lucky to have with us today experts and practitioners from a range of sectors and international experiences who will be building on the findings that Jessica, Max, and Claire have very helpfully shared with us. So the discussion is structured around 3 core themes. So we'll start off with a more general overview of the role of outcomes-based partnerships in COVID-19 response and recovery. Then we'll go into a bit more detail looking at what innovations and adaptations have looked like on a more local level. And then finally, we'll be going into a bit more sector-specific details, looking at some very practical considerations for different sectors who are hoping to use outcomes-based partnerships for rebuilding and resilience. And all this time, please do keep dropping any questions or comments into the chat, and we'll check back on these very shortly. Before we delve into the meat of the discussion, I'd like to come to our panelists one by one, and it would be really great if you could please just give a very quick introduction to yourself, so perhaps just a bit about a kind of perspective that you're bringing in. We'll be going in alphabetical order, so starting with Abha, then Emily, Jalil, Mike Ray, and then Richard. So over to you, Abha, first.
Tanya, and thank you for the presentations before this. My name is Abha, and I am one of the members of the British Asian Trust, and I lead on social finance there. I'm going to bring 3 perspectives to the discussion, Tanya. One on our running work with the Quality Education India, DEB in India, with school closure and what we did with the impact bond there. Second, on designing a skills impact bond in India currently, and how COVID fed into design and other elements. And finally, looking at new structures within Pakistan as we look at recovery over there, and how we work with the Asian Development Bank to consider all kinds of outcome-based funding mechanisms for Pakistan. So I'll bring all those perspectives and hopefully some interesting examples as well.
Thank you, Abha. Really looking forward to that. Over to you, Emily.
Thanks, Tanya. Thanks for the invitation. Great to be here. So I'm Emily Gustafson-Wright, and I'm a senior fellow at the Brookings Institution, and I'm based in Washington, D.C. I started my career 2 decades ago at the World Bank, doing research on a variety of human development topics, education, social protection, health. And for the past 7 years at Brookings, I focused primarily on education and early childhood development. But since 2014, I have been leading research on outcome-based financing, or impact bonds and outcomes funds. To date, we've published 15 studies and dozens of blog posts, which can all be found on the Brookings website. I've also advised on several impact bonds and outcomes funds, and currently we're the knowledge partner for the Quality Education India Development Impact Bond. Yeah, so that's it.
Thank you. Over to you, Jalil.
Tanya, my name is Jalil Hasboun. I'm the Executive Director of Finance for Job Consulting Services. We are tasked with implementing the first Youth Employment Development Impact Bond. We are lucky to have 4 investors with us, a mix of Palestinian and international investors. We have the European Bank for Reconstruction and Development, the Dutch Entrepreneurship Development Bank, Simio de Olivo, a diaspora Palestinian investment fund, and Palestine Investment Fund. The project is financed, or our outcome funders are the World Bank through DAI Global, who are tasked with the F4J project on behalf of the Ministry of Finance and Planning. We're lucky to have all of these partners to experiment with this new instrument. I myself have been in various employment projects in the past with DI Global and International Youth Foundation, and the background in education and teaching. We're happy to learn from all of these practitioners. Obviously, in this bond, we're targeting employment for Palestinian youth ages 18 to 29 with a focus on women employment. Back to you,
Great.
Tanya.
Thank you, Jalil. On to you, Maitreyi, and then Richard.
Thank you so much, Tanya. Real pleasure to be here. So thanks for inviting me. My name is Maitreyi. I work at the World Bank, and I manage a range of what we call global programs. And the Global Partnership for Results-Based Approaches is one of them. It's one of our larger programs, but we have a whole portfolio of programs that deal with different aspects of urban resilience and land. Today, I'm here in my capacity as the manager for GPRBA. And what I hope to bring to the table, to the discussion today, is what we have learned from the experience that we've had at the World Bank, not just in terms of impact bonds, which are fairly nascent in their sort of evolution within the bank, at least, but also what have we learned in terms of in the crisis from this giant instrument called Program for Results. So that's, I've spent many years in the Indian government as part of the Indian Administrative Service, and so have a sense of what happens on the ground and how policymaking actually takes place. And an interesting factoid about me, which I didn't know about, is that I was the first task manager of the Nepal Employment Fund, which I later discovered was considered to be the first impact bond. But yeah, thank you.
Thank you, Maitreyi. Great to have you with us. And on to you, Richard, finally.
Hi, hello, everyone. Great discussion today. I'm a senior advisor for the Global Fund and a senior consultant for the World Bank, advising principally on activity-based, performance-based contracting and performance management. And I'll talk about a couple of projects I've been working on with them a little bit later. I'm also chair of 3 social impact bonds in the UK. I've chaired 4, which previously have finished. And I am Jalil's chair of the Development Impact Bond in Palestine. Thank you.
Amazing. Thank you so much, everyone. It's brilliant to have such a wealth of experience and knowledge with us today, both across policy areas as well as different geographical contexts. And so to kick us off for the first part of the session, I'd like to come to you, Maitreyi and Emily. And so based on the range of projects that you're involved with, so including the Brookings survey that you've been leading on, Emily, and the World Bank paper we just heard about, Maitreyi, as well as many other projects, what do you think is the overall role that outcomes-based partnerships have played in COVID-19 response and recovery? And how do you think that can help governments respond to the existing demand and financial pressures? So on to you first, Maitreyi, and then Emily.
Thank you, Tanya. And you know, I've been thinking about this question. It's a tough one. And the reason it's a tough question is because we are still in the midst of a crisis phase in most countries that we work in as far as COVID-19 is concerned. And an outcomes-based contract or an impact bond, because of the huge amounts of process that are required in terms of launching it, in terms of getting the procurement in place, if you were starting out with an impact bond, you would see delays. And you would see delays for many of the reasons that Jessica already mentioned. There are delays because there are capacity issues, everyone's shell-shocked. This timing is really important. And this has not been the moment to launch a new program of outcomes-based financing, okay? That said, if there was already a program in place, so if there was already a contract in place, and that contract was a flexible contract. That contract was one that you could pivot between measuring outputs and measuring outcomes, either simultaneously or incrementally. The chances are that that particular contract would actually do quite well. And I know Abha is going to talk about some of the work that is happening in India, and we are watching that with a lot of interest to see how the quality infrastructure, quality education impact bond, for instance, is moving ahead. But let me end with one other thought, is that the COVID-19 has opened up ideas and opportunities for impact bonds to be tried in sectors that historically have not been. So historically, impact bonds have been more in health, education, some amount of jobs and skills, but still staying within very much the social sectors. How do we think about doing impact bonds or using the impact bond as an instrument in other kinds of infrastructure services, and not CapEx, of course, but infrastructure services? So that's some of what we're thinking about right now in terms of diversifying the impact bond portfolio. Back to you.
Thank you so much, Maitreyi. It's super helpful. Can I come to you next, Emily?
Yeah, great. So this has been such a rich discussion so far, and I think much of what I will share now, I think has already been said, but I'll share a little bit about two studies that we've done at Brookings exploring the effects of COVID-19 on impact bond projects. So early on in the pandemic, we surveyed 20 projects from around the world. And then we just recently did another survey that was focused on those impact bonds that were active during this time in low and middle income countries only. And we'll be publishing that study this summer. So our key question was kind of how do OBF projects respond differently than input-based financing projects? And you've already heard some of the sort of theory of change, what's the potential value add, et cetera, that Max and Jessica shared. So this is sort of our key question, kind of as the pandemic hit, and we've been thinking about throughout. So I'll just touch on 4 of our findings. And again, I think that these have been said, perhaps not this first one as much, but so one, what we found was that that outcome-based financing projects or impact bond projects that we were looking at specifically tended to have quite high levels of collaboration across the partners. Respondents in both of our surveys confirmed that this really benefited the project in terms of, when the pandemic hit. And I think that, part of this is because really strong partnerships are formed in these outcome-based financing projects. There's a lot of skin in the game. It takes a lot to get them up and running. And so those who are engaged care to see this go well, right? So it's not just like, it's not just the financing that's kind of on the line. It's, I think, everybody's blood, sweat, and tears, honestly, that it partly drives that. So that's the first one. Second one, as has been mentioned, I think in outcomes-based financing, and we had several respondents who also were able to sort of compare to input-based financing projects that they were engaged in. And as Claire said, we can't say with rigor how OBF compares to input-based financing when hit with a shock, but it does seem that they were more able to course adjust because the focus is on outcomes rather than on inputs that having to comply with particular inputs. On the other hand, however, having some strict outcomes could have been a challenge. So, as was mentioned, if there are no jobs and the outcomes have to do with employment, you're sort of stuck, right? And so this meant really having to figure out if contracts needed to be modified or other changes needed to be made. And then finally, I think also was mentioned that OBF projects really depend on strong systems of sort of frequent or real-time data collection. And this was both a benefit when the crisis hit because some of those systems were already digitized. But if they weren't, this was challenging and contributed to sort of the system collapse, and there was a lot of adaptation. We really saw a lot, I would say, of flexibility, and have seen that particularly in low and middle income countries. I have a few things to say about recovery, but I might have hit my time limit, but if you allow me a few more seconds, Tanya.
Go for it, Emily. We actually have for time for once. So go for it.
Great. So on the recovery side, I agree with what Jessica said about, sort of OBF is not sort of your first response. Like these take a long time to get set up. But, I do think that they can have an important role to play in terms of recovery. One, because they can address a liquidity constraint. So bringing in some upfront capital until hard-hit governments are able to get back on their feet. Two, reducing government and donor risk. And then also really and Max mentioned this, I really think that the system strengthening aspect by sort of incentivizing the collaboration that we've talked about, by building culture around monitoring and evaluation and driving performance management, I think really is important. I mean, we talk a lot about sort of like building back better, and I think that OBF has a really important role to play there. Finally, I think that, you know, many OBF projects, as Maitreyi mentioned, are focused on the social sector. Many of these sectors that have been hardest hit by the pandemic, including the employment sector, health, and education. But I think that there are other services within the social sector that could really benefit from a multi-pronged approach. So where you have multiple service providers that are coming at an outcome together with different types of interventions. We recently published a piece together with USC and Peru in the UK, where we talk about this. So I'll pause there. Thanks.
Thank you so much. Thank you, Maitreyi and Emily, for really helpfully summarizing those insights. I just want to turn to the chat, and I see a question there from Nigel. I was wondering, Nigel, if you wanted to just unmute and go ahead. The question from Maitreyi.
Thanks, Tanya. Yeah, I was just curious because Maitreyi gave us a very tantalizing comment that maybe she's got some ideas for other areas that OBF could be applied to. I was just interested in what they are. I was also just while I've got the floor, as it were, I was just typing another question into the chat, which is, I think a lot of the discussion is focused on kind of natural shocks or sort of whole economy shocks, you know, having outcomes around jobs when there aren't any jobs. I'm also curious about kind of policy shocks that might affect outcomes-based contracts and outcomes-based financing. So my example there is there was an impact bond in the UK, which was focused on placing hard to adopt children into adoptive families, and the government changed its policy on adoption nationally, and it made those outcomes basically redundant. That's the example that comes to mind. There may be other examples, but that's the sort of thing that I think, you know, it's a different component of resilience, perhaps there, that outcomes-based contracts may not be as suited to, or maybe they are. I'd just be interested in thoughts and comments on that.
Thanks, Nigel. Did you want to come in for that, Maitreyi? And also anyone else who wants to jump in is welcome to do so.
Sure. Those are both excellent questions. So Nigel, in terms of that sort of more of a teaser remark about where else we could potentially be using outcomes-based financing, one of the areas that we're exploring is solid waste management. So as you know, most of the countries that we work in tend to have very large informal ways of solid waste management. So if you take a look at the entire chain from doorstep to landfill, the majority of the conveyance of solid waste takes place informally, whether it is, you know, dumping outside the neighborhood, or it is informal waste pickers, or other forms of informality. There is a huge opportunity, in our view, that we could utilize that could have sort of cascading positive effects on skills, on jobs, on overall something that, you know, that is fuzzy, called empowerment, but which has been studied, and which has been there are indicators actually to measure that. So that's one area, and solid waste management, of course, is currently so important because of the pandemic, because of its public health ramifications, because of its climate ramifications, not as large as, say, transport, but certainly it's current. It's very current, and we are seeing a lot of demand coming from our client governments for solid waste management. So that's one area. A second area we are very tentatively looking at is what are the kinds of impacts that we could, or outcomes, not impacts, outcomes that we can think about towards gender equality. And again, the pandemic has been, you know, has disproportionately affected women and girls, although it has been an across the board kind of a shock. So what are there ways in which we could create incentives to crowd in capital towards some aspects of gender equality? So those are the two areas that we are kind of pursuing in terms of trying to understand and building pipelines of potential projects that we could finance through GPRBA. None of these, however, is something, and this is my own not a personal bias necessarily, but this comes from experience of doing projects for many years, is that I wouldn't go the purest route. I wouldn't go the purest route in terms of here are 5 outcomes, you come up with these outcomes, and then we pay you. There's got to be, that results chain has to be a fluid results chain, while staying true to the philosophy of outcomes-based financing. So that's the first of question that, and those are some thoughts on that. On the policy shock, we tend to, when we do projects at the World Bank, we have a huge list of risks. And we have a risk matrix that pretty much covers everything from the world falling apart to the procurement specialist getting sick. I mean, that risk matrix is literally from the sublime to the ridiculous. And when you're a task manager looking at these risks, you roll your eyes and say, what kind of a risk is that? Well, actually, COVID-19, those risks played out. And so that policy shock that you're talking about, we see that much more frequently than what we would imagine. A government changes, which happens all the time. A minister changes, priority changes. It's happening all the time. And there are times when we go back to the drawing board and redo the entire project. So that policy shock is far more common than we would imagine. And we have the risk matrices, actually very interesting things, because you lay out the risk and then you lay out mitigation measures, and then you lay out sort of worst case scenario, what would you do in case something awful happened? So like a government collapsing, for instance. So yeah, let me stop there. This is a very interesting conversation. So happy to come in later as needed. Thanks.
Amazing. Thank you so much, Maitreyi. I'd just like to move us on to the next part of the session now, where I was hoping we could bring in a few more sort of particular examples around adaptation and innovations at the local level, both in terms of project design as well as project implementation. So what does this look like on the ground level, and what does this mean for future projects design and implementation? So I was hoping to come to Abha first, particularly your experience around project design at this time, Abha, particularly around the Indian NSDC Skills Impact Bond. And then after that, I'm hoping to come to Jalil and Richard to hear a bit more about what this means about project implementation. So drawing on the Finance for Jobs Impact Bond, but also Richard, your larger work in Afghanistan and elsewhere. So on to you first, Abha, around project design.
Sure, and what I'll do, Tanya, is I'll compare and contrast design and implementation, which we did in parallel. We were changing implementation with QEI as we were designing NSDC. And whether you like it or not, when you're doing two pieces of work, they talk to each other. And I'll talk QEI first because that implementation was very current. And 4 things. One is, and people have picked on this framework, and this is Jessica's framework on partnerships. If the partnerships are robust, decision-making is faster, and we saw that. But you could be making decisions, but your service providers have never seen shock. So you could be making very quick decisions and saying, okay, this doesn't matter and that does matter. But in a country like India, where you had what we call peacetime for a long time, and now you're in wartime, then they live in peacetime psychology. To get them onto wartime psychology, it took us 6 months for them to start saying, God, this is not going back to normal for a really long time. And that now we're expecting a third wave where children are going to be affected. It is really not going back to good for a long time. That change in our service provider mindset when we were working in a country where things had been very shock-proof, growth had been there, education out, children were going into school. It was about literacy and numeracy indicators. Going back to the drawing board where children were leaving school, girls were dropping out, safety and security was an issue, food was an issue, rations were not there. I mean, the idea of learning outcomes was on no one's mind. So the first thing on design that affected us looking at this happening on the ground was that any design we do has to have extreme conditions built into it. And that's to Jessica's point with the Ghana work as well. And that resilience could either be through reset clauses or through moving to output targets, but that design had to be there. On the other extreme, Tanya, we often found ourselves always talking about extreme conditions. What if everything went wrong? Because things kept going wrong. And the human beings around the design table were going, this is going to go wrong, that's going to go wrong. So we had to really pick ourselves up and tell ourselves, okay, let's not go down that piece, or get very legal on each other. What if X sues Y? What if this thing doesn't work out at all? So while risk registers were not things we spent 100%, we spent 5% of our time on, now 100% of our time was designed with a risk register in front of our minds, which is good, but can also get a bit extreme. And so that's a bit of insight on how design and implementation sort of interplayed with each other, and we learned through each other. The second, and this is the bit I think we don't talk about enough, is how evaluation had to change as well. When you're doing, again, I'm going to use peace and war, when you're doing regular evaluation, you can go into a classroom, you can touch and feel children, you can give out tests. When you can't do that anymore, and the waves are coming one after the other, going digital on evaluations has just, it's had a sort of leapfrogging in India. So we've had to learn about how to do it, how to use tablets safely, how to not make sure your teams are getting ill, how to trust the validity of data. That's the second piece, which I think there's a lot more work to come. And I think evaluators are really going to come to their fore, because if you want an outcome, you need it to be measured. And if you can't measure it every time you deliver it, there is no outcomes contract. And so we really had to relearn and unlearn, and then relearn again on how to do measurement. Lots of really good evidence coming out of our work on that. Finally, the legals. You only hit legals if you stop talking to each other. And while legals are brilliantly important, and we spent 5 months sorting contracts, the one thing we learned is nobody went legal on each other in any of the contracts. And so in designing legals for NSDC, the one thing we're telling ourselves is, this is absolutely when things go wrong, but governance frameworks are even more important than legal frameworks. Because if our governance frameworks are strong and we trust each other and we're able to work with each other, through a shock, we will not hit the legal road very quickly. And again, there's real innovation and governance frameworks coming up with NSDC. So 3 bits and pieces there, Tanya, but lots more examples.
Thank you so much, Ava. Can I come to you next, Jalil, to talk a bit more about project implementation?
Thank you, Tanya. The Palestinian Youth Impact Bond, the F4J, is slightly unique because in this country, you plan for the worst, regardless of the pandemic. Issues like curfew, you plan for it. You plan for violent escalations due to all sorts of unforeseen events. So when COVID hit, we've already had a contract designed and approved with the World Bank. We were lucky to have planned to launch in March. The Palestinians were one of the early countries to be hit due to tourism. So we went full force into a curfew, like a serious curfew, starting March 5th, 2020. And at that point, there was a decision to be made. Should we pause the implementation like some people actually thought, or to actually implement what we had already worked on in design for 3 years? So the contract with the World Bank has been in design for several years. We were about to launch, and it was too much at stake. So we decided to go ahead and implement. We were also lucky that due to the fact that we planned for the unforeseen, not just COVID, we had a mix of outputs and outcomes. So not all the funding is tied to employment outcomes. We had a matrix of a mixture of training outputs and job outcomes. So we, with a delay of about 2 to 3 months, we launched in April, May. We had multiple service providers, so we are not implementers. We had multiple projects, and back to one of the speakers' point about having multiple service providers. I think Emily mentioned this. We had multiple service providers. We went ahead and prioritized health projects. So we had several providers lined up. One was supposed to train nurses. One was supposed to train doctors. The other in engineers for health and safety. specialists. So we had multiple projects. We decided to prioritize the ones that are related to health and safety. And we mixed service delivery in between online and hybrid training. I think because we had a good design, we were lucky to be able to adapt service delivery with each service provider on an individual basis. So I guess the key message in a pandemic or any sort of crisis, you need to have multiple implementers. You cannot just muscle out implementation if you have one service provider. So we went, I think we currently have 7 projects, one now in furniture manufacturing, we have one for education and teachers. And again, in the education, we said, all schools are now delivering online. They were able to change their training to online delivery. So we had the luxury of tweaking each service provider individually. So it was mostly bottom-up approach where the service providers told us their needs, and the World Bank and our investors and outcome funders were all flexible, and it worked out. Our jobs are all evidenced through an external verification agent. I'll move to Richard, who can talk a little bit more about our experience.
Do you want me to pick up here? So I'm
yes,
not,
please go for it.
Galil, I'm not going to talk about I'm not going to talk about your dip. You can talk about that a little bit more further on if Tanya gives us time. I want to just talk quickly about a different example and actually take us to Africa. And I'd also just like to put COVID in an African context, because I don't think we necessarily think of this outside of our own worlds right now. And to put it in context, just remember that malaria kills 400,000 people per annum in Africa, the vast majority of whom, of course, are small children. And in the last year, there have been 150,000 reported COVID deaths in Africa, just to put it in a slightly different sort of context. I just very briefly want to talk to you about mass malaria campaigns in the Democratic Republic of Congo in DRC, and how, in fact, if we don't start paying for outcomes, or at least for outputs and activities, we do not allow for the flexibility that programs need to respond to changing contexts. So in DRC, we've been looking at the distribution of malaria nets to homes in local villages. The way these things are currently managed and funded is that it basically follows the expenditure. So there is a very rigidly prescribed process that must be followed, and the budgets are reimbursed for delivery of that process. So that the service provider has to procure lorries in a certain way, provide all the paperwork demonstrating that procurement, show what they paid the lorries, literally, and I'm not joking, show how many pencils they have used in this process, and produce receipts for all of that as the nets are delivered from the depot to the local health zone, and then from the health zone to the homes. This costs in a region, in an area, roughly $12 million to distribute the nets, and about 8 or 9 million is spent looking at the pieces of paper to verify that the money has been spent where it was supposed to be. What we've been doing is trying to look at how we shift the money from expenditure reimbursement to actually paying for the key deliverables. What do we want to pay for here? It's the delivery of nets from A to the health zone, and then the registration of the households in the health zone and the distribution of those nets. So there are 3 key deliverables. At the moment, when the road washes out, because it's the rainy season, they can't do anything because they can't procure lorries and follow the process. Whereas actually they just want to put the nets on a bicycle and cycle them to the health zone. By paying for the 3 key deliverables, we give them the freedom and the ability to focus on those and flex according to the changing context, and we know it's going to change. In terms of COVID, right now we're just combining the household registration and the distribution, so there's just 1 visit per household at the same time. Tanya, I'll let you move on.
Great, thank you so much. Thank you so much, Abhijit, Richard. Fascinating to hear those specific examples from both project design and implementation. For the rest of the discussion, we have about 15 more minutes to go. I'd really like to delve a bit deeper into sector-specific considerations and invite our panelists to talk about practical considerations around those particular sectors. And so starting with whether outcomes-based financing and impact bonds can be channeled towards post-pandemic recovery for those particular sectors, and then what particular considerations we should keep in mind as we seek to build back better. And so given the expertise of our panelists today, we'll be looking at 4 main areas. So starting with education and early childhood development, we'll be coming to Abha and Emily. Then we'll be going to Jalil for employment, Richard for health, and then finally Maitreyi and Jessica Max for WASH and urban development. So on to you first, Abha, and then Emily on education and early childhood development.
Emily said I should go first, so I'm going to go first. The answer from my end is yes, it can be used. And the reason is twofold. It's actually when you take the context a little bit wider and see the amount of money that has stopped going to education this year, at a time where children have been outside school, their safeguarding issues the greatest, and girls have been dropping out like never before, going back to the gender point that Maitreyi made. I think using an outcome-based tool, using it to focus on the groups that are most marginalized and incentivizing that is one of the most important things to do. And the practical considerations, of course, down to design and simplicity. And it can also be grant plus models, and it doesn't have to be an impact bond. The one thing doing rapid relief work over the last so many weeks on behalf of the British Asian diaspora has taught us is that actually well-designed grant can also make you do that. And if our results-based financing and impact bond work can influence grant effectively, we can be part of bigger recovery and relief efforts, as against sit on the side and design only for long-term work. So doing a bit of both is the way we are going for it. I will make a pitch for health and say, actually, Richard, that is a key sector. We think we should be using that. And many health partners on relief are moving into those sorts of things because health systems have been shaken up in a country like India, and they've realized the importance of outcome-based too. So just a pitch for Richard's bit.
Great, I'll jump in on, I'll put my early childhood development hat on. So I think the pandemic should really remind us about a key initial rationale for impact bonds when they came about in 2010, which is really to provide preventive interventions early on to avert bad outcomes in the future, and with potential savings that build up over time. Up until now, impact bonds have focused mainly on youth and adults. But I really think that we know there's plenty of evidence that investing in early childhood development maximizes social returns in the long term, be it in terms of health outcomes or access to jobs, lower school dropout rates, or even reduced criminality. And early childhood development, which covers a wide range of services, that are often really poorly coordinated, ranging from infant immunizations to education to social protection programs, really could benefit from using outcome-based financing, which, like I said, has the potential to bring together multiple services together with focus on an outcome, really integrating provision around vulnerable individuals.
Thank you. Thank you so much, Abha and Emily. If I could come to you next, Julie, to speak a bit more employment.
Tanya. So again, the answer to your question is yes, we can. The issue is that we need to focus on what is it we're trying to achieve. In our case, it's youth in jobs, period. Everything else is the detail. People often speak about the skills gap and believe that the solution is training. Yes, training is one solution, but what the DIB allows is to find innovative solutions that cater for each problem in a specific context. So in certain cases, it is training. In certain cases, it's other employment obstacles. For example, when we're talking about female employment, it's interventions that are individualized for each youth. So what we've learned so far in almost a year of implementation is that we need to offer individualized service that moves away from traditional copy-paste training and employment services to allow more direct intervention to especially cater to marginalized youth. In our case, we're trying to reach out the farthest away from the labor market groups. And in this case, we had to work directly with each employer, identify their needs, and try to identify the target group they want to employ, and try to play a matching role. And this is why in our business development pipeline, as we move into more projects, we're trying to play a more active role in identifying these employment opportunities and serve these youth. And this is why we're having a growing portfolio. We hope to have another 5 or so projects.
Very helpful. Thank you, Jalil. If I could come to you next, Richard, to speak a bit more about healthcare.
Thanks, Tanya. And we're going to go to Afghanistan now. I've been working there for a number of years with the World Bank on the contracting of basic and essential health services, which are in 31 of the 34 provinces contracted out to NGOs, NGOs, but mostly local NGOs. The contracts in January 2019 were shifted from budget reimbursement to activity-based contracts. So we defined 11 key health interventions, and each one of those has now got a unit price. And the more of those 11 that the NGOs deliver, the more that they get paid. Since January 2019, we've seen performance dramatically increase across most, not all, but most of those 11 key interventions, as well as interventions that they deliver which do not have payments attached to them. We've also seen a significant increase in the quality of the data that they're producing. This performance improvement has sustained through COVID to an extent, but there are some really important messages emerging for the commissioners from this that I'd just quickly like to go through. The first of this is that the commissioners have got to think about cash in the system. You've got to recognize that these are businesses delivering these services, whether they're not for profit or for profit, and you need cash for the system to keep moving. Now, in an impact bond, the social investors play that role to a certain extent, but the commissioner has got to make sure that payment systems are managed effectively and efficiently. When invoices come in, you've got to pay them on a timely fashion. You need to have flexibility, a sense of partnership. We've talked about that earlier. But you've got to have flexibility to review the payments that you make. You may need to increase some unit prices and decrease others. You need to have a clear force majeure process defined, which you can turn on and off. In Afghanistan, we need this in place. The Taliban will come and close a health facility. We need a process in place that recognizes what money is required to maintain some sort of service so that it can stand up very quickly when the Taliban leave again. And that, again, has got to be administered efficiently and effectively. I'd like to see commissioners offer a loan facility of some sort to service providers so that when there is a difficulty, when there is a change in the context, the service provider is able to access funds to respond to that, to present a business case to access those funds, and then hopefully to repay those funds once the performance restarts. And the final recommendation I would say is you need to build the business capacity of the providers and also the performance management of the commissioners. Outcome contracts can innovate and adapt, but you do need a supportive, efficient commissioner, and a prime contractor social investor enabled in that role potentially can help. Thank you, Tanya.
Thank you so much, Richard. And finally, if I could come to you, Mike Ray, and also Jessica and Max, please feel free to jump in. You spoke a bit more about trying outcomes-based financing in new sectors such as WASH, urban development. So if you could expand a bit more on that, please.
Yeah, thank you so much, Tanya. And let me start with I used to work in the water sector for a few years. And in terms of identifying, so let me start with the challenge as far as WASH is concerned, and urban WASH in particular. The challenge is identifying the outcomes, and identifying the outcomes within a period of a project cycle. So let's say, what would your outcome be? So Jessica and I were in Nairobi, and we were talking to the head of Nairobi Water. Now, GPRBA has been very active in Nairobi for about almost 10 years now. So we have a really strong presence. We have a very strong mechanism by which to take further the work that we've already done with output-based approaches. So the guy started to basically, the gentleman started to tell us about how it was really important, and how it had led to more women going to work because they were no longer having they no longer had the drudgery of moving water around and fetching water, about toilets, about sanitation, and he was giving us all these outcomes that he attributed to the project that we had been funding for many years. And so we said, okay, this is a great opportunity. How about we give you a top up, but then we pay you not for these outputs that we've been paying you for, but we pay you for the outcomes. So exactly the outcomes that you're mentioning. So, more kids are going to school, the streets are safer. He was attributing a lot of very positive attributes within that informal settlement to the work that we had done. But when it came to the crunch, and when we actually said, okay, which outcomes would you like to be measured against? He backed off because of issues around both of attribution. All the things that we talk about when we talk about outcomes-based financing, it's attribution, it's the time period, it's the complexity, all of those things. So he was very hesitant to make that commitment about outcomes. So we're taking a step back and thinking, okay, the thing to do is to do it incrementally. So to do one outcome and an output, likely. So that's a conversation that is ongoing, still ongoing with Nairobi, with Kenya. But let me come to urban in general. So urban is a space, and it has multiple different sectors. And I'll go back to solid waste management. So we're currently in conversation with a project it's going to be just approved by the board, which is on Yemen municipal services. So it's a classic urban services project. It's got two very important entry points for outcomes-based financing. One is that it already focuses on women's employment. And because it's unusual in that, and it already focuses on women's employment. The second thing that it does is that it already focuses on solid waste management and the informal sector. So we already have that entry. And I think that's really important. I think having that entry point, which is a natural, organic entry point to identify outcomes, is really important. The second thing that's really important is championship. And I know Emily talked about blood, sweat, and tears. This is genuinely a partnership. You need to have people that are invested in it. You need to have people that are willing to go that extra mile and to make the mistakes and to do course correction, because in areas like solid waste management, you don't really know. And you're going to have to make a lot of innovation and collecting data. So let me stop with one thought and then see if Jessica Max wanted to come in. And that is, we didn't talk a lot. We talked a lot about data collection. We didn't talk a lot about community involvement. And unless communities are invested, the people that are ultimately going to be the beneficiaries, unless they're invested in this new way of doing things, it's going to be very difficult to take this forward. So I am not, even in the overall conversation on impact bonds, I'm not hearing a lot about community and communities, their monitoring, their participation, etc. But I'll stop there.
Great. Thank you so much, Maitreyi. And thank you so much, everyone, for such a rich discussion and such snappy yet concrete recommendations. Certainly lots of food for thought there. I personally really enjoyed hearing the particular examples that you all mentioned. And just given the very diverse range of thoughts we've had here, I was wondering if I could bring you in, Claire, to perhaps leave us with some concluding thoughts, and particularly any considerations for policymakers who are hoping to improve the resilience of public services going forward, and indeed plan for any future crises or pandemics. So over to you, Claire.
I will do my best. And I think Richard's comments earlier were quite helpful in terms of putting a point on some of the helpful contributions that folks have made across today's session. And I suppose the thing I would draw home is just that there's a sort of impact bond or outcomes-based thinking helps us plan for change. and including sort of crisis. And I think that kind of falls into 4 buckets from what I could sort of quickly relegate things into buckets. There's one around sort of risk and scenario planning, and this idea that having an outcomes orientation forces us to understand the various forms of risk and how they might manifest, and that you plan for them, not in the sense that you're planning every possible exhaustive, probability, but that you're practicing distributed decision-making amongst partners, and that planning process forces you into those kinds of conversations around working together. And that outcomes focus kind of ensures that efforts are targeted to cohorts, especially where multiple supports might be required to meet the needs of those cohorts. That this outcomes-based thinking really helps us better design flexibilities on our contracts so we don't, as Abba said, go legal. And so those are governance frameworks being more important than legal ones, and that you're invested in a relationship building process for the long haul, which includes communities as well. So the magic is not in creating a whizzy contract. The magic is in working together to create a reasonable contract that has enough provisions around it to sort of put a meaningful border around what that relationship constitutes as. I heard a lot of importance around measuring impact in multiple ways. And so that being an investment in kind of remote and virtual measurement systems, as well as a mix of output and outcome measurements as a way to hedge against exogenous shock. And so that's not just a tool for sort of better balancing risk across partners, but indeed risk with sort of larger exogenous forces. And then finally, I think this redundancy or slack, both in provision and resources, being an important thing. And obviously, I'm a bit biased working in the UK, having seen the sort of effects of austerity and public service provision. But this notion that you have a sort of multiplicity of both providers and services available to you, and available liquidity in sort of constrained government budgets moving forward, including the ability for governments to sort of rapidly release financing to sort of float supply chains as they might require it. So those were my 4: sort of risk and scenario planning, this design of flexible contracts and governance arrangements, which my colleague Rory speaks very eloquently about. So there's not time today, but strike up a chat with him. This notion of measuring impact in multiple ways, and indeed redundancy or slack in both provision and in resourcing.
Amazing. Thank you so much, Claire, for such a comprehensive summary. Certainly not an easy task given everything we've discussed today. And thanks so much for joining, everyone, to all of our speakers, to our participants, for also keeping the discussion going in the chat. We will now be breaking for the summer, but we will be back in October, hopefully with some more exciting monthly sessions as part of the Engaging with Evidence series. In the meantime, we do hope to see as many of you as possible at our conference in September, so please do register on our website. And also after the session, we will have a recording available for today's discussion, as well as the slides. We already have shared the World Bank paper, and we'll be sharing more of our own evaluation work going forward into the summer. So thank you so much, everyone, and happy Monday.